Lindsay Hayes, round 2.
Round 2.
So, welcome back. How are you doing?
Doing good. Yeah. I had to go through your previous podcast to see if I was the first person that was a repeat, only to realize that I'm not, because your wife is more important.
Oh, yeah.
It's like, oh, well, okay.
Yeah. So, besides my beautiful wife,
Yes.
you are the first person I'm doing round 2. Another person, so there's actually 2 people I want to get back. But one of them is Jose Dominguez.
Oh,
engineer. I'm getting him for a round 2. He was one of the very first people. So hopefully the environment will be better in the studio. I had the Bluetooth mics, and it wasn't
as good. No.
Nah, but I wanted to bring you back because a lot of stuff is happening.
Yes.
So, and then you just mentioned it right before. So this isn't your first time, your second time, third time. Now you're co-host or this and that. But you were on you said that a TED Talk, right?
Oh, so yeah. So last year I was the staff advisor for TEDxUSD. I gave that up. I got a new job. We can talk about all of this in a little bit. But last year I was the staff advisor for TEDxUSD, and one of our speakers was a gentleman who talked about inclusion and from the point of view of being a father, and his daughter has cerebral palsy, and just how that looks, things you don't necessarily think about and what that looks like in a day-to-day life. And so he was seeking people to come onto his podcast, and I filled out his form, and the rest is history.
How was it? It's not through, like, you know how they do like online Zoom, or just went like in person?
So it was through an online platform.
Mm-hmm.
And it was not Zoom. It was some big fancy I'm a podcaster platform.
You know how the Rivers is or something?
I have no idea. I wish I could tell you, but I was given the link like an hour before, and then I went. So yeah.
How was it?
It was good. Yep. So the inclusive dad, his name is Aaron. He's a really nice guy, very good interviewer. His podcast, I don't know if he's got anything posted yet. He was getting material, and then he was going to post a bunch, is my understanding. So he said he was going to let me know when it's up. I haven't heard from him, but I assume I'll hear from him soon.
That TED Talks. Mm-hmm. So I seen it. They have it at USD.
Yeah.
Is it? How do people get on that?
That's yeah. So our new advisor, Jennifer, will be seeking nominations for speakers in the next few months, to bring people to the stage to be a TEDxUSD speaker. So I assume it'll go out mostly and primarily to the USD community. Nominate yourself, nominate somebody else. And then that's the bigger pool of who they'll select from. Last year, we didn't have a lot of applications from USD people, but we did have some from people in Florida and Georgia and former NFL players. Like, it was wild. People reaching out to me on LinkedIn like, hello, I am this world premiere podcast motivational speaker, and I used to play in the NFL. There's an NFL guy that really sticks out, and I was like, how did you even find me? Like, how do you know?
Have you ever thought about doing it?
I did, yeah. So I thought about it this year. They have their theme. I don't know if it's public yet or not, so I'll keep that a little bit closer. But I think I could do something with the theme. So I don't know. We'll see. I also don't want them to unduly give me credit because I was the advisor last year. You know, I don't want to be a favoritism or a nepotism. I don't know if it can be a nepotism there, but I just don't want it to be like, oh, well, Lindsay, just a shoo-in.
No.
Even though I am podcast famous.
No, you got, like, the last time I talked to you, and you know what, that was weird, like, because I think before that I never talked to you before. And then now I notice you, like, I'll see you here at church,
right?
I'll see you like someone
on campus. Yeah. Hey,
you get to meet people. And speaking of USD, now you got a new job.
I did.
What is that job?
Yeah. So I have moved to the Office of Research and Sponsored Programs, and I am the IRB Coordinator now. So I handle all the research on campus that has a human subjects element to it. So if, let's say, Psychology is a really great example. They have a lot of human subjects research because they are interviewing people in hopes to generate generalizable research. And in order to make sure that we're doing this ethically, following federal guidelines, all of that, it has to go through an office, and that's myself. And then my new supervisor, his name is Mark. He's the IRB director. So I get to read through all those studies, but I'm also helping with undergraduate research efforts. And my replacement at my old job, I think they have someone accepted finally, but I've still been helping out with that. I'm really excited to only have one job.
Are you technically like my boss too? Because I work with Bryn or not, you know.
So not, I wouldn't say boss, but if you had, because so Bryn with like the brain research, when you are dealing with like the human subject side of that, when you're, you know, getting past the animals and past that into more clinical trial, then it goes through my office. It's not necessarily a boss of, but it's just making sure that the research studies are following these federal guidelines to make sure that, you know, you're not putting undue distress on patients, that it's done in an ethical way, that you're not doing more than what is necessary for a treatment or less than what is necessary, like equitable treatment. There's we call it the Belmont Report, and I'm so proud that I remembered that word. But it's a federal standard, a common rule that we all follow. There's IRBs all over the country in medical settings, universities, and so we all follow these same principles.
So what made you want to, just jump on that job?
I knew a lot of people that were already in the Office of Research and Sponsored Programs. So first I was like, oh, these are my buddies. They're my friends. Let's go work with a friend, which has been great. But also just a different challenge. You know, I'd been in my position for 11 years and it was a great job. I could have stayed, but at the same time, it was time to expand the skill set, I guess, is a good way to put it. Like, I just wanted to do something new.
So, I guess I won't dive too much into the university. So, no. Is there do you got special goals or things you want to be like in the future, or is it just like, hey, when the opportunity comes, I'll take it?
I think it's more of the if an opportunity presented itself. I don't have like in 5 years I'm going to be the president. Sorry, Sheila. No, we're not going to do that. But I do like the idea, like with the move, I get to see a side of the university that I didn't get to work with before. And so for me, it's more just recognizing like how all of these pieces of the university play together to make this experience for our students, for our faculty, for our staff, and just, I don't know, I find it fascinating how that all works.
No, you are right on like learning the different sides, because I think we might have mentioned this, or maybe not, because before the Bryn position, you know, I was just working in a lab in the med school, so I guess I was like a lab tech, lab technician, whatever you call it. So it was just experiment research, this and that, mostly just experiment stuff. Yeah. And when I got this one, it's more actually, it was supposed to be like a combination. So it was supposed to be the administration part and then lab, but now it's leaning more administration, like budgets, grants, this, orders, all that. And but it is way different than I thought, especially like communicating, because it was the first time I had to communicate with other people. Like,
oh, sure.
Yeah, usually like if I need someone like in the lab, I'll go to them.
Right.
This one, like I got to contact either grants, accounting, sometimes just accounting. I'll call my wife, be like, what, I need help with this.
Who do I talk to?
Yeah, Office of Research with Melinda. I'm like, man, this stuff is...
Oh, yeah. I love Melinda. She's fabulous.
She's great.
You should get her on the podcast, too. Melinda Robinson. She's so cool.
I'm going to get her husband, Greg.
Yeah.
I'm just trying to figure out time. I met their kids, and great. And athletic too.
Oh my gosh, I just love her.
Yeah, I think all three of them they play football at Mount Marty.
Yeah.
So I'm like, oh, that's kind of cool. But man, they're athletic and
I
think they're tall. Well, might be short, but Man, it's insane.
No, they're just fabulous.
I think so too.
Yeah.
Now, another thing that I wanted to know more about is how's the update with Lumpy?
How Lumpy? Well, so Lumpy is, I mean, I was just talking with the church secretary upstairs, Lynette, for those that don't know what's going on here. And this is the healthiest I have felt in 4 years, which is saying something. So the last time I was on, I think I was getting ready to have another surgery.
Yeah, I remember that.
So that was reconstruction number 7.
Mm.
So in the last 4 years, I've had 7 reconstructive surgeries and 3 additional procedures. So like after we talked, I kind of went through, I'm like, oh, that doesn't sound right. And then I'm like, oh my gosh, that is right. That's a lot of work to go through, like, so 10 procedures where I actually was completely put under in 4 years. Like, oh, no wonder why I felt so tired all the time. It's because I was constantly trying to heal. Like, oh, that's, I should give myself a little bit more grace in the fact that I haven't been going to the gym as much as I wanted to. No, I'm tired.
Yeah.
But now I'm feeling so much better. I am, back in the gym doing some fun classes. I decided to do adult ballet at Vado this year.
They have adult ballet?
They do. I didn't know that until last year. And then when I saw people that I knew participating and enjoying it, I was like, I can do that. So sure enough, I am not a beautiful ballerina yet. I am an awkward ballerina, but I'm getting better. I have until March to be a beautiful ballerina.
So now you're getting back into, I guess, like normal.
Yes. And so, the things that come with that, you work with brains and research and all of that. It's not just like, okay, I feel better physically, but, I get better sleep. So I'm more mentally acute. And then I can just, like, everything else kind of falls into place. It's the medicines I take are still not great for all of this, but the being able to exercise and being able to be active has helped tremendously.
Oh, snap. So are you like officially done with surgeries or
I mean, no, I'm feeling good right now, but there's still a lot of scar tissue just because of the radiation. Mm-hmm. Some people, they get by without very much, but I have just a lot of internal scar tissue. And so my guess is in the next year or 2, hopefully I can put it off that long, I'll have to have another reconstruction. So
with the reconstruction, with that scar tissue, like what happens if you, like, do you need the surgeries or how does that work?
So yes and no. It's not like I need it for a health purpose. Like, these are all with my plastic surgeon. But I need it because there's a lot of pain involved. So with the capsule that the implant is sitting in, it squeezes. And so like that, it gets very tight and very like just rigid. It doesn't want to move. And then there's a lot of scar tissue that forms around that. So if you can, be okay with pain, then yeah, that's fine. But turns out that I'm not. And so it's constantly trying to spread that scar tissue out, to loosen it, to soften it. It just takes a while.
Okay. I've never had a surgery and I've never been under anesthesia. My sister and my parents have. What does it feel like?
Well, it's one of those, it sucks to be good at something, but I'm really good at having surgery. Like, what a horrible thing to be good at. But I've had it so much that like I know exactly what to expect every time. The worst part for me, so I have very, very sensitive hands. Like just if I hit it wrong on the table, I'll pass out. Like, yeah. But every time I go for surgery, they want to put the IV in my hands. And I have so the hardest part of surgery for me is just getting the IV started, because I'm like, don't put it in my hands. They're like, well, we always do. You have a great vein. I'm like, I know, it's wonderful, but don't put it in my hands. I'm going to pass out. They're like, well, what about right here? I'm like, that's still my hand. Like, and so I have to point out, I'm like, from here to here, anything there is fine. And they're like, oh, I'll have to get someone else. Like, 9 times out of 10, they have to go find somebody else to start my IV. It usually takes a couple shots, and I'm like, I don't care. You will not touch my hands. Like, just no. So, once they start the IVs, in my head, I go, okay, yep, here we go. Because then they'll give me the medicines that make you nice and tired. And I know when I go into the operating room, like they're going to put the thing on my face. I try to say something that makes them laugh before I go under, but I typically don't remember because like, okay, here it comes. I'm like, ah, and then I'm out. And then I wake up and I'm like, hey, can I have some Jell-O now? I mean, like, that's it's just like, it's such a standard thing for me now, and which again is kind of a sad thing to be really good at something so horrible.
Does it feel like when you sleep, or like do you just, you pass out and you wake up? Or are you dreaming, or?
You don't remember a thing. Well, I don't. I mean, I can't speak for everybody that's had surgery, but for me, when they put the oxygen on my face and I'm out, and the next thing I know, I am in a recovery room and they're asking me how I'm feeling, and they ask if I want toast or if do I want something to drink, and they're like, we have apple juice and da da da. And they list their all their things, which by that point I'm starving because you can't eat at so many hours ahead of time, and I'm like, I want a Diet Coke and I want Jell-O, and always cherry Jell-O. I don't know, and they always seem to have it, so. That's my post sedation meal: a Diet Coke and cherry Jell-O.
Okay.
Yep.
So, okay. I always wondered how it felt, because like everything I say, I get my information from the internet. So I don't know how accurate it is. That's why I've wondered, like, hey, do people get that out of body experience, or are they like dreaming, or this?
I recall absolutely nothing. There has not been a single moment in any of my surgeries where I've been like, like, hey, I can't feel anything, like the horror stories of maybe one medication isn't working, or, nah, I think that those are horror stories because it happened to one person and it's horrible. But for me, it's all very standard.
Does that even, like, I've heard that when they say, like, they're under, but they could kind of they're still aware.
Yeah.
But wouldn't, like, the doctors know?
Yeah, you would think so. I mean, especially the anesthesiologists, like they know their jobs. They know their jobs very, very well.
Okay.
Yep.
So it's maybe it just happened once and now it's just exaggerated.
Somebody said it happened to, my sister-in-law's best friend's older brothers, like it's almost like an urban legend. I'm sure it does happen, but at the same time, I think it's so infrequent that it's not something that somebody should be worried about.
Okay.
Yeah.
See, I thought I was going to go a few years ago. I thought I was going to go under for what do you call them? The
wisdom teeth.
Yeah. I think they pulled 3 of them because I need one. And I get my information from YouTube, and I was like, oh, well, they put you to sleep, and then you wake up and you're all like, oh, I don't know, freaking out or something like that. No, all they did was they injected me with
with like Novocaine?
Yeah, something like that. And then I guess for the no pain, and then you just...
Oh, well, yours probably were already through then.
Yeah, they were.
Okay. So they put you asleep if they're impacted. So if they're still in again, I got my research comes from the same source, YouTube. If your wisdom teeth are still impacted, if they haven't actually gone through the gums yet, then they have to like cut the gum open and do all that. So that was my first surgery, was my wisdom teeth, like back in high school.
And then another actually a year and a half ago. So I had LASIK surgery.
Oh yeah.
But this one they didn't put me under. I thought same thing. I thought they did. So, but I remember this because I was talking to my mom or my sister about it a few days ago, because my sister qualifies, so she's thinking about it, but she's scared. Same thing. She looks at YouTube. They cut your eye. I'm like, no, I did it. It was amazing.
Right.
So I remember going in there, and then they take you, I guess, to check vitals and this and that. And I remember reading saying that they could give you an optional pill to relax.
Yeah.
First, me, I'm like, no, I'm macho. I don't need nothing. But I remember I was like,
always take the pill.
Yeah, I was very nervous. And then she said, hey, did you want it? I'm like, yeah, sure, it's fine. And then they gave it to me. And then they walked out. I think they said, yeah, we'll pick you up like in 10, 15 minutes. We'll take you to the room.
Yep.
And then I was just, there. And then for some reason, it took effect. And So I was nervous, and then I was ready to go.
Yeah.
I was like, let's do this. Let's do it, everyone.
Feels so good.
Yeah.
You get LASIK and you get LASIK.
I was pumped. And then I went in there. I don't know. I was just so pumped. And then I swear it lasted like less than 10 seconds.
Oh, yeah.
Bye-bye. And that's it.
Yeah.
And I'm like, that's it. And then one of the things they said not to do, because Myra had to drive me, because it was in Sioux Falls.
Yep.
They said, try not to sleep. Well, okay. Man, I was just so, I guess that's a side effect.
Yeah.
I was so tired. And then Myra saying, hey, don't go to sleep. And I'm like, okay. And I'm like, I can't. I'm so tired. And I think I fell asleep, but I was just tired.
Yeah.
But man, those in medicine, like, it's powerful.
It's crazy. I mean, I think about when I was going through active cancer treatment, like the chemotherapies that I had, it like they were intense. They were no joke. I mean, they kill off everything. I had shaved off all my hair because I wanted to keep that power. Yeah, I knew I was going to lose it. But even then, like, it would grow back like minuscule amounts, and then I'd have another round of chemo, and it would just like, I could rub my head and it would come off. And I'm like, wow, this is pretty intense stuff. But they would give me, the medication for an anti-nauseatic, so I never threw up once during chemo.
Oh, okay.
Which is, I was so worried. I was so worried I was just going to be like in the bathroom, unable to handle this. No, I didn't throw up. Then they gave me, stuff for almost like a motion sickness. And then they gave me, relaxers, like all these things. So for the first few days after my chemo, I would be on a pretty heavy pill regimen. But at the same time, I was able to function, which it's like, okay, I mean, there's a benefit in the medicine, a huge benefit in the medicine. It's not great to do it all the time, but boy, when it's prescribed and done right, it's just incredible to me. It's incredible the research that goes into this. I don't know how much the medications have come in the last even 10 years.
Yeah.
It's crazy.
One of my friend of mine, his name is Mark, super smart person. Now he's a professor here at USD. He was a postdoc. I think I was talking with him. We were talking about medicines, like, hey, what's the future of it, or like, is it getting advanced, this and that? He says if I remember, I think it was him. I'll say it's him. They were saying that these medicines, it's not like they're not like super powerful, but like they're getting better, as in hopefully they're having less side effects. I guess like first generation, whatever it is, there's a bunch of side effects. And hopefully like every new whatever they do, there's just less and less and less.
Yeah.
So,
well, it is. It's taking a drug to combat the side effects of the other drug to combat the side effects of the other drug. So you wind up with 3 drugs because this first one was bad in these ways. So you try to even it out. So, I think if in the future drug number 1, it doesn't have those side effects, well, then suddenly you cut out drugs 2, 3, 4, and 5. But you won't know until drug 1 changes. And maybe it's, I don't know. It's crazy to me.
And so what do you think about, I guess, no, not the pharmaceutical companies, but what do you think about like medicines and all that? We won't go political. Because before, when I was younger and, I thought I knew everything, I was one of the people who was like, no, I don't need no medicine. I don't need no this and that. You just got to do the natural stuff until nothing bad happened. But my dumb thing, we went swimming and we went to a water park. And for some reason, I was like, I don't need sunscreen, because I guess whatever, humans need the skin or need the sunlight or whatever you call it.
Yeah.
So it was like 6 hours there. And
without sunscreen?
Yeah, I didn't have any sunscreen. And I remember I still remember we were under the canopy thing. And then they were saying, hey, you're like really red. And I was red. And I remember the pain. Man, it was like bad. And then the night was horrible because I burned my whole arm, my back, and my chest. Yeah.
Yes.
Not my chest. And I started sweating, and then you can see all these like blisters pop up. I don't know if they're no, they had to be blisters. And
oh my goodness.
But it was all over my back. And I remember I had, because it was in the summer, and I had a summer class, like a government course for history, and putting on the shirt. It was horrible. And I was like, what am I doing? So after that, and this was like 2014. So right after that, I wear sunscreen like almost all the time. That's why, one of the reasons, not also, well, because I'm used to the heat, wearing a long sleeve. If I'm out there for like 1 hour, I will put sunscreen.
Oh, yeah.
Even though I have like a darker skin than most people, I will put it because I am that scared of it.
Well, yeah.
Yeah.
Because it is. I mean, sunscreen, we do think about that as not necessarily medicinal, but it's, a preventative thing. So I think as far as like medicine itself goes, there is different takes on, I mean, so I come at this from the lens of going through my cancer treatment. There were, some people that had said, oh, well, this is a lymphatic thing. Doing some lymphatic drainage, doing some of that will help, not maybe necessarily cure your cancer, but it's like, you should be doing this. And I'm like, okay, that. Thank you for that advice. I appreciate it. But I'm going to go with Western medicine. I'm going to go with doing, the chemotherapies and doing all this, because it has been researched. It has, been very verified. My type of cancer, they know how to treat it. So while it sucks, it's never fun to have cancer. Mine is like, they said this is the kind they like because they know exactly how to treat it. And so I'm, in my mind, fine, let's go with that route, because I have 2 young kids. Survival is a big thing for me, big thing for everybody. And so I think, my take on medicine, it kind of like you, it has changed. It's not like I was ever, I wouldn't consider myself like a homeopathic type person, but I am much more willing to take a medicine prescribed to me now than maybe I was before, just because I do know the effects, even like a pain medicine after surgery, because if there's no reason to be in pain. There just isn't. Like, there's no, like, yeah, I'm going to be all tough. I'm going to be all Midwest about this one. Like, oh, no, nothing hurts me. No, that's ridiculous. I do get kind of the scare of it, though, also, because I can see how these things could be very addictive. Yeah. I can see how these pain meds can, I mean, they feel great when you're in pain and all of a sudden you're not, or it's manageable, or you can live life, or you're more awake. I can see how these become an issue for some people. Me, luckily, I'm not one of those. I take them as prescribed, but there's always that fine point. At what point is it too much? At what point is it not enough? Do you have an addictive personality? I don't know, and I can't answer that for other people, but I can definitely see how that can happen.
Yeah, I think it's that kind of like that balance thing, because even something small like what do you call it, ibuprofen?
Oh yeah,
yeah. I never used to take it, and now I take it if, for example, if I get sick, like it's like a really bad flu or something.
Yep.
I'll take it, and then you just feel good. You're not in pain. But same thing. I'm not like, I don't want to keep taking it like every single day, because I don't know what to do. So but yeah, because when you're in pain on anything, especially if it's physical pain, man, it sucks. Like, it's
exhausting.
Yeah, it sucks. No, actually, no. I do got another example. Like back when I hurt my back, I swear it was. I can't describe it. I bet it's common when someone hurt your back. It's horrible. Like, you can't walk, you can't pick up stuff. You're like, what's going on?
Yeah,
I can't do anything. And I remember Ryan Mollenkamp. He's the one that was helping me on that. And he said, hey, you gotta take those pain meds for, like, I think he said a few days.
Yep.
And I was thinking, I was like, man, I don't want to take it. I was like, I want to be that macho guy. But no, like, you take it, then so you could tolerate, so maybe you could do those exercises and this and that, and everything's fine. So that's good. But now I get that,
Yeah. I mean, and there's a reason for it. I think a lot of times we do get scared, like, well, what happens if I become addicted to this and I can't deal with it otherwise? But I think, more than anything, if you're working with a physician or a physical therapist, somebody that you trust their opinion, that they have your best interests in mind too. So really, I think there's a reliance on somebody else. And yes, physicians, physical therapists, occupational therapists, they are just people too. And always recognizing that they are going to, as a person, want you as a person to be a better feeling person. Yes. So it is a trust. It's a reliance. I did not like that at the beginning of my cancer treatment, because it was like, I don't know these people. And just because you say doctor, it doesn't mean, like, what if you're a bad doctor? I don't know. Like, you could have graduated last in your class, but yet here I am literally putting my life in your hands. And so, it was Dr. Hack is my oncologist, but in my head, I call her Keely, just because it makes it more personal.
Oh, okay.
Yeah. And so it's, to her face, I call her Dr. Hack. Or even my breast specialist, Dr. Dirksen, it's Jesse, but it's Dr. Dirksen. And so it's like, if I can talk to Jesse about this, it brings you back to the reality of, we are all just people, hopefully trying to make this world a better place. Their job as doctors is to treat the patient. And my job as patient is to listen to doctors.
Now, speaking of doctors and like the advancement of medicine, let's talk about the healthcare. This is where I'm going to get off topic like I always do. So what do you think about AI entering like the healthcare stuff? But like, I hear it. Them like saying, oh, it's going to replace doctors or this and that. Do you think it's cool? Do you want that to happen?
Well, I can see some of the benefits of AI in certain circumstances. When diagnosing maybe less life-threatening, like you have a cold, or even on campus, they developed an app in our computer science department that if you coughed, it could determine if it was a COVID-19 cough. There's so much research about it. I don't quote me on all of that. Ask Casey Santos. He will let you know what happened with that research. But I will say, like, that sort of AI could be very beneficial, I think, especially when you do consider a pandemic and not wanting people to be in a space together. So if I have COVID-19 and I go to the doctor's office, well, I'm potentially infecting everybody in the waiting room or the physicians or the nursing staff or whoever it is that I'm interacting with. Whereas if I had an app and went and it says, that's a COVID cough, get your butt to bed and take this new medicine. I think that is a benefit of an AI. When it comes to dealing with a patient, though, so with my care team, the reason that I went with the care team that I went with is because I needed someone to like physically hold my hand through this. Like there's no way an AI, well, and maybe I'm wrong. Maybe AI will become like super advanced, but there's that human aspect where I don't think you're ever going to replace somebody being there physically with you in these dark, dark times. And that's why we have support teams. That's why we have, the people alongside our family and friends. And family and friends are great, but they don't have the answers the doctors have. They don't like this, that, but sometimes if your friends are doctors, then you still have that. But for the, the large, vast majority of people, they don't have their doctor being a best friend that can sit down with them. And so as far as AI taking on that role of like, how do you deliver bad news to somebody? How do you say like, hey, this is all of the horrible things. I remember when my oncologist said, you're going to lose your hair. I mean, it's devastating at that time, but like, I would have rather heard that from her than a computer. And no, the hair loss, like, like, well, that's, like the personal side of healthcare, I think, is extremely important. And it kind of bridges that gap between like the unknown and the treatment.
Yeah, you're right. Because I was just thinking about it, like, same thing when I had the issue with my back.
Mm-hmm.
I rather have, like, for example, like exercises. Of course, there's every exercise on YouTube. Maybe I don't know which one's which, but, generally they're all the same. But I think it's better, like, if I had Ryan help me out, or even, like, I'll give a shout out to, like, my chiropractor, Dr. Robe, like, having that person, they can either, like, motivate you or say, hey, this is this.
Yeah.
It's kind of different than, just, reading something, hey, do this or this and this.
Right.
Like, that human aspect part.
Yeah.
Yeah.
Where it is more personable. It is more personal too. I mean, we're talking about relations. So, I could call or message my oncologist office through an app, it's the Sanford app. And I'm, ask a question about, will this drug interact with this drug? And they get back to me. That might be replaced by AI at some point. But at the same time, I don't know if it completely could be, just because you need that person that knows you and knows your treatment and knows maybe like the psychological things that are going on, the health risks that are mental more than physical. I don't know if, maybe AI will be I shouldn't say will be, but is advanced enough to recognize that, but I don't know.
Have you seen that movie with Will Smith called iRobot?
No.
Oh,
I have not.
Okay. What about another movie called Ex Machina?
No.
Oh, you're killing me. No, okay. This one, because iRobot came out in early 2000s.
I know of it.
Yeah, and
there was that one with Haley Joel Osment too. He's a robot. The parents couldn't have children, and so they like said a special phrase to him, and then he became sentient, essentially.
Like Pinocchio?
No. Well, I mean, no, not like Pinocchio. So he was still a robot, but he became like, he called them mom and dad. And
when did this movie come out?
Oh, it was after The Sixth Sense.
Oh, no. Okay. There's another one called Chappie.
Nope, not that one.
Okay.
Anyway.
Yeah, anyway. But now I'm thinking about those it hasn't happened yet. But like those robots, I discuss this with my wife all the time.
Terminator. There we go.
There's a good one. That's a perfect example. So you hear like a robot just like that. Well, except the killing part. But
no, not that.
The kind of human aspect, this and that. Would it, or also, like, have you seen the movies Alien?
No.
Like with the xenomorphs? No? With the, oh, snap. Okay. I need to send you a list now. But anyway, there's these androids. All these movies I'm talking about, there's always a robot.
Yeah.
They always have that, human aspect of that. I think, I don't know about now. I don't know even if our lifetime, I'm hoping. But if we get to that part, do you think, would it be a problem? Like, you think people are going to be like against them, or I'm going way off topic.
I know. Wow. That's a fascinating question that I didn't think I was going to be asked today.
Philosophical stuff.
Yeah, right. Wow, that's deep. I don't know. Is there a soul?
Yeah. Oh, whoa. Or what do you think? Like, would you like that? Would you not? Or,
I don't know. I mean, and I think when you think of AI, like a lot of people do think of robots. They think of straight up like a humanoid type thing that reacts the same way as a human and would be indistinguishable. However, I think more AI is just in a cyber world type experience. So, I mean, I think that, taking like Chat GPT as a for instance, where suddenly you could write an entire dissertation by putting in a few keywords and here's resources. That could be and is dangerous. Like, are you actually learning anything? You are, writing a cover letter, for instance. So at what point is it machine learning, artificial intelligence versus an actual human learning experience?
Ooh. Now, see, because you're bringing this up, like, so I grew up when internet started, like, coming up. So I don't know, but like before that, do you think people were hesitant, like when Google and them came out? Like maybe some people are like, oh, you're just gonna Google stuff or go on the internet? Why don't you read a book or this and that? Yeah. But nowadays, it's a great tool. Well, I guess depending on how you use it, but
right.
Yeah. So I don't know if that's the same with like the Chat GPT.
No, I mean, well, and it's it's also asking the right questions. So. Yeah, you can get a lot of information. You can get a lot of disinformation too, or misinformation, because people can post whatever they want. And so, if you're talking about machine learning and the generative knowledge there, well, is it learning fact or is it learning opinion? I don't know. So this is not my area, but it's a fascinating question.
Now I'll go. Another one kind of connects too, because so I always talk about Mark. I'm telling you, he's a smart guy. But his goal is, and he showed me all this data and this and that. So what he wants to do is he wants to solve aging. Yeah, he wants to like stop it. That's his goal.
Okay.
And I always talk about that. Like, hey, what would it look like or how you do this and that. So like, I think the idea is like I don't know, I guess makes for example, like a pill or something, and you have it and then you stop.
Stop aging?
Yeah, wow. That's the idea. But let's say it happened. So I'm thinking, all right. Because I feel like anything's possible. But what happens after that? Like, of course, it'll be expensive, but would people want it? Because the first thing I'm thinking, like, yeah, I would do that. Why would I want to get old?
Yeah.
But I talked to Myra about it, and she said, no, she doesn't want to do that. I'm like, why though? She said, why would I want to live forever?
Yeah.
But I'm like, well, why not? And then you keep thinking, like, well, I guess one of the things is like, man, I'm going way philosophical and deep on this stuff.
Yeah.
I guess like, cause life is short. If I get to live forever, does that mean like, am I going to stop doing stuff? Cause I guess also like you kind of do some items because you're like, oh, I don't have enough time for this or this and that. But if you had all the time in the world, what would you be like?
Well, and that's fair. I think, you would like to think, cause even, I mean, I don't know about it sounds like you and I were probably a lot alike when we were young because you say that I'm not going to put sunscreen on. I'm indestructible. And then turns out that massive amounts of second-degree burns. It turns out you're not indestructible. I think, for me going through the cancer treatment and all of that, you realize your mortality. So, yeah, maybe you could live forever. Maybe that, whatever drug stops aging, that does not stop the bus from hitting you outside. It does not stop probably major diseases. Would you want to live forever if you had Parkinson's, or something like that, or any other kind of any other disease?
Yeah,
got that one out.
Because another thing, like same thing. Don't quote me on this. I would say I talk with him because, it's just all research and stuff he's thinking. I would say, like, well, what could be the side effects? He knows the science. Like, what are the side effects? Like, what could go wrong? Trying to stop aging.
Yeah.
I think but he said one of them could be, I guess it would because it wouldn't just stop. I think he said it would kind of reverse it.
Oh. But
one of the side effects that could happen is like cancer, the tumors and all that. And I'm like, oh, that's good?
No. And again, it's the side effects. It's you have the drug, and then what are the side effects of that drug, and how are you combating that, or what's your plan to make sure that the side effects are minimized?
Yeah.
Anyway, and I mean, And the amount, like I say, it's a fascinating thing to think about, even the fact that a drug like this might exist, but then to know the process of how it gets through these different research studies and where it starts and how, like, it finally, not this drug specifically, but how any drug gets to the shelf and gets into the hands of physicians to give to patients. Like, it's just crazy to me. And that's some of what my new job is looking. I mean, not to that, like, I'm not the one saying, hey, new drug, but you do get to that point in your research studies where you have human subjects. And that's where the IRB comes in. Mm-hmm. Yeah.
Well, speaking of that, like, how long have you been in the position so far?
Since July. So
still newish.
Yeah, really new. Yeah, very green.
So let's say you're in there for a few years.
Yeah.
With all that knowledge, could you possibly like open up your own biotech pharmaceutical company, this and that?
No.
No?
Not me. No. No, because I'm not a researcher.
I don't think you have to be a researcher, right? Don't you have to be like business oriented?
I think at that point, we have another, I guess, part of the office with Kirby Fuglesby. She is the transfer tech person. So when you're looking to, or excuse me, not transfer tech transfer. So when you're looking to, what's the word? You're getting a patent. When you're looking to patent a product or a drug, you work with Kirby to do that. But me, no, I have no interest in doing any of that.
Oh, really?
None, zero.
Oh, I would think, you have like the perfect skills. You get to know this.
No, I mean, I'll get some skills, but that is not one of them. That's not. I honestly don't. If that was part of the job, I'd quit. No, thank you.
Well, before we run out of time,
yeah.
So what's next? I think I asked you this too. Like, because now there's a lot of stuff going on.
A lot of stuff going on.
Like,
yeah.
Plans.
I don't know. Yeah. So I mean, something coming up really soon, October 19th. I'm getting married.
Oh, snap.
Oh, I know.
Congratulations.
Yeah, thank you. His name's Travis. He's fantastic, and I love him. So, yeah, it's becoming, like, it's really close. Like, that's 3 weeks from today, or from tomorrow, excuse me. And, yeah, so it's a big step. It's obviously a very big step. But I'm so excited. Yeah, snap. So excited.
Anything also with... with careers or same thing? Like you were saying, you said, I'm not planning on being president, but
no, I'm good with learning this new job for a while. It's hard to go and be in a position, and be the newbie when in my previous position, I was the go-to person and had all the answers. So that's been a struggle for me. A bit, just to be like, I don't know, and I miss things, and I'm not used to that. I'm not accustomed to not knowing. I don't like it.
Oh,
I don't like that at all.
I've never thought of that.
I know.
Yeah, because because you said if there's like on your previous job, everyone went to you.
Everybody.
And now you're new, so I guess now you gotta
I gotta go to everybody else, and I'm like, I don't know what I'm talking about. I can't solve your problem without somebody looking over my shoulder to make sure I can solve your. Oh gosh, it's ridiculous and exhausting.
See, I wish I had that problem because, like, at the previous job, I didn't know anything. And then now at this new job, I still don't know anything. I still gotta go ask. Hopefully, one day I get to that level where, like, hey,
we're just gonna ask.
Yeah, hopefully.
Yeah.
Well, I think we are running out of time.
Yeah,
so, any last things, last words, or anything you want to get out?
Yeah. Just we're coming up on October. October is Breast Cancer Awareness Month. Yeah, I know. I kind of thought maybe you would do this just because it was coming up to that month. Just to keep in mind the women that are diagnosed, men that are diagnosed. And so this is my little aside for Breast Cancer Awareness Month for your listeners, for people in Vermillion. Is to really be mindful, because a lot of times people will shove pink down your throat. And you'll see, like the NFL, they're selling pink jerseys, they're doing all these things. Really make sure you know if you're buying a pink product because you feel like you're supporting, make sure you know who you're supporting. So if they say we're selling pink jerseys, or, there's a pink dog leash, I don't know, that they are actually supporting a recognized breast cancer research or the American Cancer Society, but the money's actually going somewhere, and it's not just going to line other people's pockets.
Okay.
This is a really big thing, because a lot of times companies will profit off of breast cancer, and that's kind of disgusting in a lot of ways. Don't profitize off of my disease. But there are a lot of really good people out there where they sell the pink because they are giving the money to a recognized, I was a 401k, definitely not that, but a recognized nonprofit. So I would say just be very mindful in this coming month. You see pink, make sure you know why.
Is there like events going on around that time close by or nearby?
I'm sure that there will be. Just, keep your eye out for them. It's not, we don't really have a little group or anything, which is actually not a bad idea to have like a little, I'm sure there are, Facebook groups that you can join, but as far as something specific to Vermillion, no, we don't have anything like that. So, keep your eyes out. Just be mindful. Recognize what the pink means.
Okay.
Yeah.
I'll keep my eye on that. Sweet. Well, I want to thank you so much, Lindsay.
Yeah, you too. Thank you.